you know melanoma is the most common cancer in the United States? In fact, more skin cancers are diagnosed in the U.S. each year than all other cancers combined. According to the American Academy of Dermatology, 1 in 5 Americans will develop some form of skin cancer in their lifetime. Research shows melanoma can be far more dangerous than other types of skin cancers, for the simple fact that it can metastasize and cause harm to other parts of the body, even death. I too am a lover of the sun and have used tanning beds myself. However, scientists say UV rays are the biggest cause of melanoma. To help you better understand melanoma, I will explain what it is, the risks and symptoms, and available treatments. Before I begin to explain the risk factors, symptoms, and treatments, let me tell you about what melanoma actually is. In the pamphlet Melanoma, published by the National Skin Cancer Institute, it says that melanoma is a type of skin cancer. It begins in certain cells in the skin called melanocytes. The skin has 3 layers: the epidermis, the dermis, and the subcutis. To understand melanoma, it helps to know about the normal structure and the function of the skin. Now that we have a better idea of what it is, we will now go on to the risk factors and symptoms of the disease. There are several risk factors that come into play when it comes to melanoma. For example, just to list a few, there's genetics, skin color, and how many moles you have, how much UV radiation you've been exposed to, and if you've had sunburns as a child. In the book Melanoma, William Sharfman writes, patients with ethnic skin types are more likely to have more advanced disease at the time of diagnosis and have lower melanoma-specific survival than Caucasians. Caucasians are 20 times more likely to develop skin cancer than African Americans. This is due to protection of the skin pigmentation. Those with red hair, light complexions, or freckles are also at a higher risk for developing melanoma. However, regardless of skin color, there is a risk factor when the skin is being exposed to UV rays. It is good to practice and monitor your moles, particularly if you have many or in a high-risk group. When examining your moles, look to the ABCDE guide to help you. A is for symmetry. A is for symmetry. The 2 halves of a normal mole are not more or less mirror images of each other. A malignant or typical lesion, on the other hand, is noticeably symmetric. B is for border. Borders of a melanoma are typically jagged and irregular. C is for color. Most normal moles have consistent color, light or dark brown. Melanomas can appear in a range of colors: brown, tan, blue, red, or dark brown. D is for diameter. If the diameter of the lesion is greater than 6 millimeters, about the size of a pencil eraser, it can be a warning sign. E is for evolving. If a mole has increased in size, changed color, and shape, take serious note. Lastly, after looking at the symptoms of melanoma, we will now talk about some of the many treatments available for the disease, which is curable. There are several different treatments for melanoma, including surgery, immunotherapy, chemotherapy, targeted therapy, and radiation therapy. Surgery is the mainstay of therapy for early stage melanoma and for the resection of isolated metastatic melanoma site. Immunotherapy is a type of systematic therapy used in the treatment of melanoma at high risk for a reoccurrence metastasis. Targeted therapy is a type of therapy where drugs or other substances are used. Chemotherapy is a systematic type of therapy intended to destroy melanoma cells throughout the body. However, chemotherapy has shown little success in the treatment of melanoma. In review, I have explained what melanoma is, the risks and symptoms, and many available treatments. So now that you know melanoma is the most common cancer in the United States, please don't be a statistic. Wear your sunscreen, limit your exposure to UV rays, and if you think you might be at risk, see your dermatologist to catch it early so that you can be effectively treated.